Hi there, folks. I am happy to share with you a brief summary of the clinical elective opportunities that we hope will be available to you in the spring of 2023 through the DGSOM Global Health Program. And in prior years, we would do an overview session for the students that are interviewing each day to describe all of these experiences. And it feels much more efficient to be able to do this one time recorded. And then we could use some additional time to answer any questions that you have when you interview. So I'm going to take you through a summary of the 10 opportunities that you may consider applying for. But first, I want to highlight some important dates. You folks will have between 3 and 4 weeks to submit your applications if you'd like to pursue one of these global health electives. And we're going to interview everyone who is interested in participating. And we have 3 different interview dates. And I'm going to include these dates in the materials that will be sent out to the class. So you'll have these in email. It's our great hope that we'll be able to make final decisions and turn things over within a week from the time when the last folks interview, so that we can let you know by the end of September so that you can plan accordingly. And we've had to move up the timeline earlier because some of our sites, in particular India, requires that we submit application materials almost 6 months in advance. So there are some external pressures that have led us to move the timeline up. And then there are 2 required orientation sessions. There's a mandatory pre-travel orientation session. It says all day, but we usually wind down in the early afternoon or mid-afternoon. And then there is a mandatory feedback session on the day before graduation. So let's hit the individual rotations, and I'll give you a quick feel for what each of these experiences are all about. This is a summary of the opportunities that are available in Sub-Saharan Africa, in Asia, and in Latin America. And you'll note that there are 2 in South Africa. There's one in rural South Africa in KwaZulu-Natal, and there are multiple options in Cape Town. Mozambique, Malawi. In Asia, we have China, India, and Thailand. And in Latin America, Mexico, the Amazon region of Peru, and a new opportunity also in southern Brazil, in Porto Alegre. So here's the scoop. First one, we'll start with Cape Town. Oh, I should mention that there are 2 sets of elective dates. The first set of elective dates will be the first 3 weeks right after match day. So I think match day is on Friday, March 18th, and whatever that Friday is, the following Monday, you'll be starting one set of electives, and then 3 weeks later, there's another time window. So it's the first 3-week window after match day and the second 3-week window after match day. And there are reasons why these are divided up between those 2. Part of the reasons for the South African ones all being in the second 3-week window is related to licensure requirements for actually have to file with the medical board in South Africa to get you folks processed to have permission to be able to practice medicine as a medical student in the country. Anyway, there's a lot more detail to that, but in short, these are the elective dates for Cape Town for the upcoming year. It's the second 3-week block after match day. And there are lots of options in Cape Town for you. The rotations are held at Somerset Hospital. This is a major teaching hospital for the University of Cape Town School of Medicine. This is a long-standing partner. Years ago, we started sending students to the emergency department. It's a great emergency medicine experience, but the opportunities have expanded, and there are opportunities for you folks to do emergency medicine, pediatrics, internal medicine, and possibly also OBGYN and psychiatry. And usually we can send 3 folks to the emergency department and a couple of folks to peds and internal medicine, and occasional students doing psychiatry and OBGYN there. This is a mid-level hospital, so it is not a tertiary quaternary care hospital, but it's a safety net hospital, and the care is quite sophisticated there. The emergency department feels very much like Harbor UCLA. To me, it's a similar patient population, Harbor UCLA, in a new building, just as Harbor has a renovated emergency department facility. And medical students will together, we've been sending anywhere from 6 to 10 students to Cape Town at any one time. Will usually get an Airbnb apartment, make sure that you run the neighborhoods by us before those apartments are rented, and it's a fantastic experience. All right, a very different experience, and I think equally fantastic on the other side of the country, is a rotation in very, very rural South Africa. And this is a first-level hospital that is led by family physicians. And these folks are incredible. They sort of do it all. These family docs sort of do it all. The first time I was there, they in one of these hospitals, they took me on a tour. They showed me the operating theater where they do minor surgeries and cesarean sections. And they said, we, meaning the family physicians, do all the surgeries here. When I asked them who does their anesthesia, they looked at me and said, we do our own anesthesia. So there are circumstances in which the one physician may be doing the epidural, doing a C-section, delivering a baby, resuscitating the baby all at one. They have, it's also a teaching site for medical students from the medical school in Durban. And this past year, we switched to another rural hospital called Lilongwe. And the students who went there last year had a phenomenal experience. And if you are interested in Lilongwe, you should ask Tracy to send you the video of Anana and Boris, who went there last year. You'll get a firsthand view of the experience there. This is very different than Cape Town. You will fly into, most folks will fly into Durban, trying to find the pointer here, and Durban, and then you will drive a few hours into the bush. Other students have flown into Johannesburg up here and have driven down to this region. That's more of a 5-hour drive. So it's you're going to land hopefully together with other students. Up to 3 students can go to Mozambique. You're going to rent a car. It's left-sided driving and left-sided stick shift, and you're off into the bush. And it is an incredible learning experience. All right, Malawi is a very long-standing partnership, and those of you who are familiar with the internal medicine residency program will be maybe familiar with the partnership that exists there. The Department of Internal Medicine sends residents to a faith-based NGO in Malawi, and this is predominantly an outpatient experience, although there is a smaller component of it, seeing their inpatients. It's mostly an adult medicine experience, but there will be some children seen there, and it's very heavily focused on caring for patients with HIV/AIDS, although there'll be a fair amount of general medical care as well. And there will be opportunities to visit some of the other health centers, including the large public hospital in Lilongwe. There will likely be internal medicine residence there for at least part of your stay, and will likely be have an attending physician for at least 2 weeks of your stay at Partners in Hope in Lilongwe. And you can see that unlike the South African rotations that are the second 3 weeks after match day, the rotation in Lilongwe starts in the beginning of the first 3 weeks after match day. So match day is Friday the 17th, and then Monday the 20th, you're in Malawi. So Friday night after match day, you're off to the airport. All right. Also in Africa, is the experience in Maputo, Mozambique. And this experience is synchronized with the dates for the South African electives. So students can join up with the South African students, and South Africans can either visit the Mozambican students and see the beaches in Mozambique, or the Mozambican students can join the South African students for safari. We couldn't synchronize the dates for the Malawi elective based upon availability for slots at the Malawi site. The experience in Maputo is mostly a pediatric experience. Mozambique is a Portuguese-speaking country, and you don't have to be fluent in Portuguese to participate. It is helpful, though, to be conversant in Spanish. One of the most amazing highlights of this experience is to work with Chris Buck, who is a UCLA pediatric faculty member who is based in Mozambique, and he is overseeing our partnership there and the training program and our research partnerships. Chris is phenomenal. He is one of the best teachers and role models you can imagine working with. This is an experience at a huge public hospital. It's the main teaching hospital for the main medical school in the country. It's a 1,500 bed hospital with an average daily census of 3,000. And in the children's hospital, which is on the main hospital campus, those kids are often doubled up in the beds or in the cribs, and sometimes sleeping with one or two parents in the bed as well. When I first started working in Maputo, or established the partnership, at the time there were 10 million children in Mozambique, and there were only 10 pediatricians in the entire country. And this is a country that suffered from years of civil war after their independence from the Portuguese, and it took them years to start getting physicians in the pipeline. And Chris Buck, our pediatrician, is doing an unbelievable job supporting that teaching program now. Mozambique is a very, very long country. It's actually longer than the west coast of the US, and it has some incredibly spectacular beaches. All right, onward to Hangzhou, China. This one is probably the most tentative of the elective experiences, because we don't know what the visa requirements will be to get into China, and whether or not at the time of this elective, whether folks will still need to quarantine. You can see the dates of this of the hopeful China elective are the first 3 weeks after match day, and this is an experience at Zhejiang University in the city of Hangzhou. And for those Mandarin speakers, I'm sorry for not doing a very good job at pronouncing these names. Hangzhou is about 2.5 hours southwest from Shanghai, and you could either fly into Shanghai and take the train down, or you can fly directly into Hangzhou. Zhejiang University has multiple teaching hospitals, and the main hospital where students have been working is called the second affiliate hospital. And traditionally, the students have done the following experiences for their 3-week elective. The first week, you can choose a specialty service of your choice. So you can do really any specialty that you'd like. Most folks have done the specialty that they've matched in for residency. The second week, everyone does a week of traditional Chinese medicine. And I will say that some students have elected to do 2 weeks of traditional Chinese medicine versus 1 week of a specialty of your choice and 1 week of traditional Chinese medicine. The third week, you will leave the city and travel with 2 local medical students, and they will take you to a more rural community, and so that you can get a feel for medicine, the way medicine is practiced, how primary care is practiced outside of the big city. And you'll spend 3 to 4, sometimes 5 days in this semi rural setting, and then go back to the big city at the end of your third week, and then either travel in Asia or come home. And you can see that this rotation is in the first 3-week block after match day. The folks at Zhejiang are incredibly generous. They have a house that they give to our medical students, and there are lots of places to get food between the hospital and the apartment, and they're just two blocks apart. The other rotations, there we have leads for housing for you in all of the settings. All right. One of the other experiences in Asia is tried and true. Students have been going there for many years. This is in Bangkok. It's at Sirirat Hospital, and this is at one of the oldest medical schools in Thailand, and it's a phenomenal clinical setting and wonderful teaching. Oh, I just forgot to tell you, for China, we have had students go who are non-Mandarin speakers, but it's been challenging for them. So some proficiency in Mandarin would be very, very helpful for the experience in China. In contrast, the experience in Thailand, you don't have to speak Thai, and most all the attendings and residents will speak English, and there'll be a lot of translating for you. And depending upon the number of students who are going to Thailand, we can try to tailor the experience more towards your specialty interests, but most folks have done pediatric infectious diseases and adult infectious diseases, although there's been some variation over the years. And then everyone does a week of Thai massage, and there's a whole Thai massage center on the medical school hospital campus, and it is very much incorporated into the care of patients in this setting, and it's a phenomenal experience. You'll all get Thai massages on the house there. All right, Mumbai, India. We sent our first students to Mumbai last year, and this is in the first 3-week period after match day, and this is at King Edward Memorial Hospital in Mumbai, and this is a massive public teaching hospital for a very academic medical school in the city, and our first students had an incredible experience. One of the students went into pediatrics, and the other one went into surgery and was interested in ped surgery. So they chose to focus their experience in pediatrics and pediatric surgery. But there are also rich opportunities in internal medicine. And there are multiple hospitals in which you can rotate. Now, this experience is organized by an alumna of the medical school who is an internist. She went to medical school. She was raised in Santa Monica, went to college and medical school at UCLA, trained in internal medicine at Cedars, met her husband, who is from Mumbai, and raised her family there. And it's kind of an Indian-American family. The children have, all 3 sons went to Stanford, and they travel up and back quite frequently. But Dr. Godrej has settled in India and she has been quite amazing in setting up this experience for our students. And there is housing provided for this experience, and be happy to connect you with the students who returned from India. And one of them is Cody Eros, who is an intern across the street in pediatrics. So be easy to connect with Cody and pick his brain about the experience. All right, a relatively new one that we set this up, and we had hoped that we would be able to send students there this year, but there were some COVID-related issues, and this is just across the border in Tijuana, and this experience is in the first 3-week block after match day, and this is an experience at Refugee Health Alliance, which is a nonprofit organization. They do really incredible work across the border, and there's a huge migration of folks from all throughout Latin America who get stopped at the Tijuana U.S. border. And it's not just folks from Latin America, a fairly large number of Haitian immigrants and immigrants from sub-Saharan Africa who make their way to the border. So there are there are communities of refugees that are housed by the NGO, and they also provide primary medical care. So this would be a very rich experience to not only do hands-on clinical work, but it would also be a phenomenal opportunity to learn more about issues related to refugee health, and also play a major role in advocacy to help folks to be able to cross the border for medical assistance. This one does require you to be conversant in Spanish. And the folks that we met there were really terrific. One of the founders of this nonprofit was an emergency medicine physician at Harbor, who still works here in Los Angeles, but commutes quite frequently. So you have an opportunity to be working with both American and Mexican attending physicians in this outpatient setting. All right, Iquitos, Peru is one of our oldest partnerships, and this is in the first 3-week block after match day. And this is in northern Peru. They're not far from the Colombian and Brazilian border, and Iquitos has been described as the densest city in the world with no road access. It is an island. It is an island city completely surrounded by the Amazon water. So the only way in is by plane or by boat. So you would fly to Lima, and then you would take a 2-hour connecting flight northeast to Iquitos. Rotation is at the regional hospital of Loreto. This northern region of Peru is the state of Loreto. And so this is the referral hospital for all of the rural Amazon. And some of the patients will travel by boat for up to 2 weeks to seek medical attention in the city. And there are opportunities to work on either the pediatric service or the medicine service, specifically the adult ID service. And you'll see lots of medical problems that you would see here in LA, but lots of unusual things, lots of tropical medicine, malaria, dengue, a lot of snake bites and infected snake bites, and lots of tropical diseases. The person who runs this program is an adult infectious disease specialist who has special expertise in adult infectious diseases, and students have really enjoyed working with Dr. Casapia. And there are some guest houses in the community as well. And this one, you really need to be speaking conversant Spanish to be able to soak up the experience in this setting. Okay, and a new one. We've not sent any medical students yet to Porto Alegre, although we've been receiving medical students from Porto Alegre, and this is a city in southern Brazil. It's actually between Sao Paulo and Buenos Aires, Argentina, not too far from Uruguay as well, as you can see on the map. The dates are not set yet for this, and we might have flexibility depending upon the students who are interested in this elective as to whether or not they're in the first 3 weeks or the second 3-week period. There's a medical school that has been partnering with us for our work in Mozambique. So this is a Portuguese country. So and this is an experience, though, that is supervised by English-speaking physicians, and the leadership there is absolutely committed to teaming you up with English-speaking attendings and residents to help navigate the system. And they have said they've had many English-speaking rotators from other places in the world. Folks who don't speak Portuguese rotate with them, and they've had great experiences. And Chris Buck from Mozambique has been to the medical school in Porto Alegre, and he said it's a phenomenal training experience. And we're hoping that some folks will be interested in experiencing medicine in southern Brazil this year. So I'm going to stop screen sharing here. That's a quick, maybe not so quick, overview of the opportunities that are available to you. All of these experiences will have your airfare will be covered, and there'll be a stipend to help defray costs of your living expenses. Depending upon where you're going, some sites will be more expensive than others, and the additional stipend should cover most of your expenses, but not all of your expenses in some setting. Just a reminder that all students participate in a pre-departure training program, and this includes cultural sensitivity sessions, health and safety sessions on diseases, medical problems that are endemic to the region of the world in which you'll each be rotating, etc. So lots more that we can discuss when we meet individually, when we meet first as a group for interviews, and then when we chat individually during the interview process. But we wanted to give you at least some details on each of the experiences so that you can be better informed about your choices. You can each submit one choice, but would encourage you to rank 2 or 3 choices and put them in rank order, and we'll do our best to try to place people. I will tell you, on a year-to-year basis, the popularity of one rotation varies at the site varies from year to year. So one year there could be 10 students who wanted to go to the Amazon, and the next year there could be 2 students, and the same fluxes have occurred with some of the other choices as well. So we will do our best to place as many folks as possible in sites in which they're most excited. All right, that's it for now. Let me know if you have any questions, and we look forward to chatting more about these. You can email me if you want to talk more about these. Tracy Wells and Dr. Tracy Wells in the Global Health Program knows these experiences very well. And so Tracy is available to chat about some of the details and can share feedback from students over years past. All right, have a good one.